Welcome to Mercy Medical Center's live webinar. Today we are discussing new strategies to cope with pain. Joining us is Mercy's pain psychologist, Dr. Luke Hansen. After his discussion, he will take questions from our audience. To submit your questions anytime during the discussion, go to the window in the upper right-hand corner of your screen and type in your question. If you don't see the screen, click on the orange box with the white arrow. Your questions will be anonymous, completely confidential. So, Dr. Hansen, let's get started.
All right, thank you. As Lynn said, my name is Luke Hansen. I'm a psychologist for Mercy Outpatient Psychiatry in the Regional Back and Spine Pain Center. I treat individuals with chronic pain that can be back and spine pain, neuropathy, fibromyalgia, arthritic conditions, migraines, and what I do is typically assist patients in recognizing the multiple factors that go into making up their pain experience and try to help patients identify ways in which they can cope with their pain, many of the strategies that we'll discuss today. So I'm going to jump right into it, but what I want to start with is just describing those multiple factors that the pain experience. It's important to recognize that pain is much more than just the biological experience or the physical discomfort. That's what we recognize most because that's what's bothering us, the burning, the aching, the stabbing pains, whatever they may be. So there is that biological part of it, but it's much more than that, and it's important to therefore treat everything that goes into that pain experience. So, but we'll start with biological. Obviously, biologically, the pain signals that the body has been harmed. It serves a purpose at first. It serves tells us that we've been injured or that there's an illness, and it has that protective factor. But in chronic pain, it has lost its usefulness. It's no longer informative. That's the biological aspect of pain. But pain is also a psychological experience. Pain is usually experienced by people as suffering and can result in a range of emotions, whether that be anger, frustration, grief, fear, am I ever going to feel better? Loss is a common theme, depression and anxiety. So there's that psychological part of pain as well. Third, pain is a behavioral experience also. It changes the way we act, behave, the way we move. We may isolate more. We may be less able to work or unable to work, may be less social or engage in the hobbies we once did. So it's an experience that affects our behavior as well. Cognitively, the fourth component there, pain forces us to think about its meaning, its causes, and possible remedies. It gets in our head. We obsess. We ruminate about it. We may do endless Google searches to see if we can figure out an answer, a cure, and usually we end up with more questions than answers. And also on a cognitive level, it can interfere with our focus, our attention, and the medications sometimes we take can do that as well. And then finally, spiritually, that's part of the pain experience as well. It reminds us of our mortality, and sometimes the people I see are experiencing a crisis of faith as well. I hear people come in and say in one way or another something along the lines of, how people say that God never gives you more than you can handle. Well, I've had more than I can handle, and I hear that quite a bit in one way or another. So the reason I wanted to go through those different components is because, again, you have to treat all of that. Treating pain is not as simple usually as taking a medication or having a surgery. If it is that simple, then typically it's not chronic pain. It's something that, just getting the appendix removed and you're good to go. Chronic pain is much more complex, and treatment needs to involve multiple approaches. The medication management, medical procedures or surgeries if necessary, but also that psychological aspect, or physical therapy, or a number of other approaches. And this is focusing on that the emotional experience, the psychological impact of pain is what I work on with my patients quite a bit, whether it be addressing the behavior changes, the cognitive impact, the psychological impact, or even the spiritual impact. Before I get into the specific strategies, just one more slide here on some of the supporting evidence, just so you know that I'm not making this up off the top of my head. There's a lot of evidence to support this, what we call this multimodal approach to treatment, or multidimensional approach, which means that we're treating it looking at all of these different aspects of the pain experience, not just the biological or physical experience. A lot of studies, as you can see here, support psychological approaches, but also a lot that support this multimodal versus unimodal, meaning just one treatment approach, just maybe the medical approach or just the psychological approach. The best approaches incorporate all of that. People who have chronic pain that are receiving this multimodal or multidimensional approach are 36% more likely to return to work sooner, 33% more likely to report pain reduction, 42% more likely to reduce medication, and 40% more likely to increase activity. So that's some pretty good support for this multidimensional approach being more effective than a single approach alone. This is taken from a study in 2007, which is kind of a meta-analysis of a lot of different research studies that have been conducted over the last decade. One thing quickly before I move on from this slide that I'll point out, these numbers, even though they support the multimodal approach, overall there's certainly room for improvement. I mean, if you look at pain reduction, even 37% isn't a great number. Increase in activity, 53%, certainly could be better, but you have to remember these are studies about chronic pain, so this is pain that has already been proven to be treatment resistant and has not responded to other approaches, so that's why these numbers are low. It also just speaks to the fact that coping with pain and chronic pain is a complex issue and a difficult one for both the person experiencing it and the health professionals that are trying to help. So let's get into some of the strategies. I'm going to be covering 4 different areas or different types of strategies over the next half hour or so. These will include increasing awareness and understanding of your emotional response to pain, initiating the relaxation response, learning some cognitive techniques, as well as some behavioral strategies. Okay, first, becoming aware of your emotional response to pain. Before jumping into different techniques and strategies, I think it's important to really identify, okay, how does pain affect me emotionally? How does my reaction to the pain emotionally then affect the pain? Is it making it worse or having an impact in that way? And then also on the front end, does my emotional state contribute to my pain? And one way in which you can do this is to use a pain diary, which will help you kind of get an idea of these patterns. If you look at this slide, you can see a sample pain diary. A lot of you with chronic pain may be used to that 0 to 10 scale of, you know, where is your pain at, and maybe tired of that scale. In fact, this is quite a bit more in-depth. It asks you to fill out on a day-to-day basis 3 times a day that you might choose. Describe the situation so you get an idea perhaps of what triggers or patterns are. Describe that pain not only in number but also by the quality of the pain. Is it stabbing? Is it dull? Is it shooting? Is it burning? But then it also goes a step further and asks you to describe that emotional response to pain. And that's something that most people don't pay enough attention to. I mean, they know they don't feel good. They know they feel pretty rotten when they're in pain, but they don't think about necessarily what am I feeling. Is it fear? Is it anxiety? Is it sadness, loss? Is it anger? And rate that as well on a scale of 0 to 10. note, is that emotional response taking a toll. And then also this diary asks for you to write the action that you've taken in response to it. It's really important from my perspective in working with patients to focus on this emotional response because, obviously the doctors, the surgeons are doing their best to help you find some relief from your pain from a physical standpoint, but what you can best control is that emotional response. And when you control that more effectively, one, perhaps you take the edge off of the physical pain because, when we're responding with anger and frustration and fear, our muscles tense and our body stiffens, and that only exacerbates the pain. And two, when you get a handle on that emotional response, maybe even despite the pain, you can find yourself suffering less. It is possible to experience pain without necessarily so much suffering. So again, in a nutshell, the benefits of a pain diary, one, you're starting to take back some control. You're exploring your pain. You're trying to get a handle on it. That's one reason it can be effective. Two, you're recognizing patterns and triggers. What am I doing? Does stress contribute? Is it physical activity? What kind of stress contributes? And then three, you're recognizing your emotional response to pain. What am I doing that's helping? What am I doing that's not helping? So that's a first step in trying to manage your pain, is really getting a handle on that emotional response or psychological reaction. So getting into some of the other strategies. There is the first I want to talk about is the relaxation response. But before I want to get into that, I want to talk about chronic pain as being a form of chronic stress. Stress itself can contribute to chronic pain, but chronic pain then turns around itself and becomes a form of chronic stress. It's difficult day to day to deal with this chronic pain, and it wears on us. And what happens when we experience chronic stress, or in this case, chronic pain, what happens is something we refer to as the chronic stress response. And a chronic stress response is associated with reduced immunity to disease, diarrhea and constipation, sleep disturbance, fatigue, shortness of breath, poor concentration, headaches, weight changes, muscle tension, anxiety, depression. For those of you who deal with chronic pain, that probably goes without saying, as many of you have probably dealt with some of those things. It's an automatic response of the body when we experience prolonged chronic stress or pain, and it happens, unfortunately, whether or not we want it to. However, the good news is that there is a way to try to counteract it, and that is what we refer to as this relaxation response. It's something that was first described by Herbert Benson out of Harvard Medical School in the 1970s. And again, it's a natural response that we can create. It's not automatic like the stress response. We have to make it happen by using some of the relaxation strategies I'll discuss. But what they found is that it can help to have an impact on our nervous system. It makes it harder for the sympathetic nervous system to become aroused by daily hassles and stresses, or when it is aroused, it returns to normal more quickly when we regularly initiate this relaxation response. Again, I'll get into some of the techniques that can do this very shortly here, but on the short term, the relaxation response lowers blood pressure and heart rate, breath rate, and oxygen consumption, and can take the edge off of pain. But in the long term, it seems to have a cumulative effect. When we practice this, I recommend about 20 minutes a day. It seems to have that impact on the nervous system so that it's less easily aroused by stressors. So after about a month or so of practicing these techniques, we can notice a difference even when we're not in the midst of actually doing a technique. It has that cumulative effect and can protect us. So I want to talk now about how we then initiate that relaxation response. There are a number of strategies, deep breathing, progressive muscle relaxation, meditation, visual imagery that I'm going to talk about next. But as I'm talking about these, there are two things that are common themes throughout all of them. First of all, they all involve focusing your mind on either a repetitive phrase, a word, a breath, or action. Secondly, they all ask for you to adopt a passive attitude towards thoughts that go through your head. And what I mean by that is, as you're doing any of these techniques, your mind, it's just human nature, there's going to be a lot of what we call mind chatter that kicks in, that takes you other places. You're in the middle of a deep breathing exercise, and before you know it, you're thinking about, I just don't feel good, this isn't working, the kids need braces, the Cubs lost again, whatever the case may be, your mind may take you there, and it's very important for these to be effective, and in order for the relaxation response to be activated, you need to respond to these thoughts by just kind of gently guiding yourself back to the exercise you're working on, and not becoming frustrated or trying to fight off those thoughts, because it won't work that way. Just realize that's human nature, and that's okay, that's part of it, and guide yourself back to what we're doing. So the first one there on the list is deep breathing. And the first thing I would want you to know about deep breathing is there are two types of breathing. There's chest breathing, and there's what we call diaphragmatic breathing. And we really want to be more diaphragmatic breathers than chest breathers. We're not entirely sure, but this diaphragmatic breathing seems to be associated with better ability to reach a state of calmness and relaxation. And the best way really to know whether or not you're breathing in a diaphragmatic manner is if your stomach is rising and falling as you breathe, whereas a lot of us breathe through our chest, and that's associated with a little more tension. We start out as diaphragmatic breathers. If you watch an infant sleep, you'll notice their stomachs rising and falling, but for whatever reason, a lot of us become more chest breathers over time. So other things to know about deep breathing, it can help improve circulation, which can help with pain tolerance, and it forces you to focus on the present moment. It's a distraction, and again, just remember to maintain that passive approach to any thoughts that get in the way while you're breathing. When you're breathing, you just want to make sure you're breathing regularly. One strategy is to breathe in up to 3-1,000 or 3 Mississippi on the inhale, hold it for 1 second, and then exhale for 5-1,000 or 5 Mississippi. Now, I'm not going to actually have people do these relaxation strategies today because there's too many to get through, but I will show you some links later that you can look at where you can go through some more in-depth exercises. Deep breathing, I started with that because it's something that it's effective on its own, but I find it more effective when you add it to other approaches like meditation. Meditation is, again, repeating a word, a phrase, a sound, or a mantra to yourself that, again, it serves as a distraction and helps you kind of feel more in control over your mind and perhaps of your pain. You have to, of course, remember to stay passive to those thoughts that might creep in there. But what meditation does is it helps you get into the here and now. If you can stay focused on that repetitive word or that phrase, it can really help you avoid worrying about the past or focusing on the future. And that's the idea, to get you to that different state of consciousness that can help you tolerate pain and initiate that relaxation response. All of these techniques we're talking about kind of help you to float with the pain that you're experiencing. Pain initiates that fight or flight response, but the trouble is with chronic pain is that we can't fight it off and we can't run from it much of the time. And when we do try to fight it off, basically what we're doing is we're responding to our pain with more pain, or responding to our anxiety or frustration with more frustration and more anxiety. A third strategy for initiating that relaxation response and managing pain is visual imagery. Visual imagery, there are a number of different possibilities in which you can use it. You can also pair that with deep breathing, where you may take a deep breath and then vividly imagine that breath finding its way through your body to the area that is affected by pain, and then imagine it kind of attaching itself to that area of tension or pain, and as you exhale, watching that or visualizing that pain and tension leave with that exhaled breath. Visualization is also used to imagine a safe place that you can go to where you're pain-free, or pain is more manageable, or visualization can also be used to imagine or give your pain a shape or form, to ask it questions, or to vividly imagine yourself dispensing or disposing of the pain. And the key to visualization is just that you use as many senses as possible. So not only do you want to visualize these things, but you want to hear them and taste them and see them and smell your safe place as well. Progressive muscle relaxation is also on the list there. That involves systematically tensing your muscle groups and releasing them. That is your way throughout the rest of your body, your calves, your thighs, your stomach. I even do my face if nobody's looking. And you do that 5 seconds through each muscle group and then release. And this works for a number of reasons as well. One, again, it's a distraction tool, but also on a physiological basis, it helps with that circulation again. And also, it's hard for the body and the mind to be on the same page. So when we're trying to relax, sometimes it helps to start with the body. If I tell you, just relax, it's hard to do that. And from a mental standpoint, if I tell you to relax physically, it can still be difficult. But if we do it in this systematic way where we tense our muscles and then release, we notice the difference. We notice that absence of tension a little more effectively. And when the body becomes relaxed, the mind usually follows suit. Again, it's hard for them to be on separate pages. The body sends that mind the message that it's time to relax, and ideally that helps us cope with the pain and initiate that relaxation response. The last couple of there, repetitive motion. For a lot of people with chronic pain, a lot of motion or exercise is difficult. This can include things like yoga or tai chi, but walking, running on a treadmill, swimming can all count as this repetitive motion and can initiate the relaxation response, but it should be coupled again with the deep breathing, paying attention, regulating your breathing while you're doing these exercises, and also maybe incorporating the meditation, repeating encouraging or soothing phrases repetitively to yourself. Finally, self-hypnosis. Basically all hypnosis is self-hypnosis. There's no magic to it like we see at the comedy shows. There are trained hypnotherapists that can help facilitate that hypnotic process and help a person reach that different level of consciousness, but basically you're either suggestible and allow yourself to reach that different state of consciousness, or you're not. But there are different approaches that can be used. There's something called autogenics training that where you repeat to yourself that certain areas of your body are feeling heavy and warm, or you are telling yourself that the areas that are hurting are becoming numb, and you gradually, through this hypnotic experience, numb various parts of your body. There are different phrases that can be repeated to help take people to a different state of consciousness, like the image of an elevator going down or going down a flight of stairs until you reach that different state of consciousness. So those are the different relaxation techniques that I wanted to talk about. So we've talked the relaxation techniques. We talked about all the different components of pain: the physical, the psychological, cognitive, etc. The relaxation strategies can help regulate the nervous system and address the physiological side. It can help if you incorporate, spiritual components into your meditation or some of those strategies you're using. But I want to turn now to some cognitive techniques. Oh, I forgot. I want to go through. This is the slide on the relaxation exercises. But if you're interested in going through some more in-depth relaxation exercises, there's a link here where you go, and then once you are on the site, you enter the word healing, and you can have access to download these different exercises. They include visualization, meditation, and deep breathing, and they're all about 20 minutes each, so you can get that recommended 20 minutes in one shot there. However, for a lot of us, you may feel like I just don't have that 20 minutes a day to block out to do a relaxation exercise. Then try one of these mini relaxations at least, or try multiple mini relaxations, we call them. They can be just as effective. Just do it more often throughout the day for a minute or two at a time. It can be as simple as the number 1 there. Whenever you have just a minute, take a deep breath. As you breathe out, imagine all the tension in your body and mind leaving through this breath. I actually like the 3rd one there on that list. Take an inventory of body tension and your familiar stress points. If everybody would just stop now and just pay attention to your bodies, it's amazing when we stop and do this, where we can notice that different areas of our body that are tense, our shoulders, our back, that maybe we didn't even, we don't ever stop to think about it. And when we stop and think about it, we have no idea of knowing just how long our body has been that tense. So when we stop and take that inventory and recognize where the tension is and release that, that's very important and helps to initiate that relaxation response. So once you find it, take that inventory, take that deep breath, imagine that breath going to where that tension is, and as you breathe out, imagine the tension leaving with that breath. So those are a few examples of some mini relaxations you can use if you don't want to do a longer exercise. So as I said earlier, I want to turn my attention to some of the cognitive techniques that we can use, but I want to start with a few quotes that I think describe it pretty well. The first is by Ralph Waldo Emerson. The quote is, "What lies behind us and what lies before us are all small matters compared to what lies within us." When I read that quote, I think basically the saying is that it's not so much the things that happen to us, it's more how we, or the things that will happen to us, it's how we think about them and interpret life's events that makes a difference in how we cope with them. And that includes pain. There's another quote, Craig T. Nelson. He was an actor on a sitcom Coach, and I think he had dealt with chronic pain, and I remember his quote being something like, "I finally realized that if pain has to be mandatory, at least suffering is optional." And some of you who are struggling with chronic pain may feel like whacking me with your good arm or your good leg when you hear that, because who am I to say that you shouldn't suffer or when you're feeling this pain? I'm not the one feeling your pain and have no idea what it's like. And to that, I guess I would say I hear you, and I've met with a lot of people dealing with these issues, but it's really the best chance we have sometimes to deal with this is to try to change the way we think about things and to try to realize that despite the difficulty of pain and the loss that we're experiencing, that there are ways in which we can try to think about life or continue on or behave or act that make the pain more tolerable and that allow us to live life without suffering quite as much. One other quote is an excerpt from a Native American folk tale that I want to read really quickly. One evening, a wise grandfather told his grandson about a battle that goes on inside people. He said, "My son, the battle is between two wolves who live inside us all. One is evil. It is anger, envy, jealousy, sorrow, regret, greed, arrogance, self-pity, guilt, resentment, lies, false pride, inferiority, superiority, ego. The other is good. It is joy, peace, love, hope, serenity, humility, kindness, benevolence, empathy, generosity, truth, compassion, and faith." The grandson thought about it for a minute and then asked, "Which wolf wins?" The grandfather simply replied, "The one you feed." So when we're in pain, it's easy to feed the pain and make it stronger by reacting to it with anger, self-pity, and resentment. If we can find a way to respond with hope, faith, and serenity, we are feeding the part of us more that can effectively cope with the pain. So basically, what we're getting at here is that we are what we think. Certain ways of thinking are associated with chronic pain, or particularly a disability in chronic pain. Thoughts of feeling a lack of control as if we're helpless against our pain are associated with poorer levels of functioning. However, there are things that we can do to try to get a handle on our thinking. First of all, you can keep a thought log similar to the pain diary that we discussed earlier, but also just internally trying to be more aware of some of the errors in thinking that a lot of us make. I'm just going to run through some of them because they're common to a lot of us. One is what we call all or none thinking. That's, for example, if you're someone who used to play softball but can't anymore because of your pain, the all or none thinking may take you places such as thoughts, well, I can't enjoy the sport anymore at all because I can't play it. And, that may not really be the case. You may be able to play in a more limited capacity, or you may be able to coach or watch, and certainly that will be bittersweet, but it's better than that nothing that leaves us depressed and feeling hopeless and helpless. Some of us overgeneralize and wake up in the morning with pain and think I'll never be able to do anything anymore, and that just, again, those types of messages contribute to depression and make the pain more difficult to deal with. Some of us do what's called or referred to as disqualifying the positive. That's when you may hear something positive and kind of disqualify it. For example, a friend may come up to you and say, hey, you look great, and your first thought may be, this guy has no clue. I feel like total garbage, and he's telling me I look great. He just doesn't get what I'm dealing with. And I have a chronic pain group, and I hear that a lot from people, that it is a frustration that people with chronic pain live with. No doubt that people can't always see the pain, and they don't understand, and that lack of understanding just makes the whole experience harder to deal with. But sometimes we have to find the positives in those comments that, okay, well, at least I apparently look better than I feel, and not disqualify that. We can also jump to conclusions. We wake up with a headache and tell ourselves now the whole day is ruined. That kind of sets up that self-fulfilling prophecy for ourselves. It makes it much more likely that the day will be ruined, when in reality we really don't know how that day is going to turn out until we just take it as it comes. Or labeling is another cognitive distortion that we sometimes fall into, where we label ourselves in unhealthy ways. We, instead of seeing ourselves as individuals that struggle with chronic pain, we may label ourselves as defective or broken or whatever else. So that's the first step to I guess, managing the cognitive part of the pain experience, is to just recognize some of those distortions or errors in thinking that we have, and then responding with more encouraging self-talk. The key to self-talk is to really try to make it realistic. You know, you don't want to find yourself rolling your eyes at yourself as you say these things to yourself. If you don't feel like $1 million, you shouldn't tell yourself like you feel like $1 million. But when you wake up and you're sore or you're in pain, at least telling yourself that, you know, I'm going to put on a comfortable outfit and do the best I can to find some distractions today and see how things go. It will not come naturally. What comes naturally for a lot of us when we're in pain are more of those negative thoughts, more of those errors in thinking. But it is doable. It is like learning a different language. You know, first when you learn a different language, you have to translate everything in your head, and it's frustrating. But the more and more and more you practice it, you know, one day you find yourself thinking in that language. And that's how it is with this type of talk. You'll get discouraged, but and it'll feel forced, but force it for a while until it becomes a habit. I was at an art store in Cedar Falls a few weeks ago, and I saw a piece of art that was describing gratitude. And the quote on this sign or this painting said, "Force gratitude until it becomes habitual." And that's what it's like with this self-talk, that we have to force those feelings of gratitude, remaining grateful for what we still can do rather than focusing on what we can't. And that's easier said than done, don't get me wrong, but if we force that, it can become something that becomes a bit more natural for us. And then finally, the affirmations, that last one there, just refers to sending ourselves those positive messages, making them personal and again, more focused in the present rather than looking towards the future or focused on the past. So that's a way to think about dealing with the cognitive experience of pain. And I want to end with talking about some behavioral strategies. Really quickly, just want to read a quick poem here called Little Things. Most of us miss out on life's big prizes, the Pulitzer, the Nobel, Oscars, Tonys, Emmys, but we're all eligible for life's small pleasures: a pat on the back, a kiss behind the ear, a 4-pound bath, a full moon, an empty parking space, a crackling fire, a great meal, a glorious sunset, hot soup, cold beer. Don't fret about copying life's grand awards. Enjoy its tiny delights. There are plenty for all of us. So as I was saying earlier about gratitude, you know, a lot of times we've lost so much when we're in chronic pain. We can't work at the same pace or can't work at all. We can't pick up our grandkids or play with our kids as much as we would like to. And it is frustrating. And sometimes we feel like even those little things are affected. But a lot of times when we focus on what we've lost, we miss some of those little things that we can still do. And it's very important to do them because maintaining a sense of control over our lives and maintaining some degree of activity level physically and socially is very important in terms of our prognosis and in terms of maintaining quality of life and living with chronic pain. So the key is really to stay balanced. You know, you need to neither fear activity nor do too much. Some people go in extremes. They become determined that I'm not going to let this pain beat me, and then it does beat them up for a few days when they push it too much. Or people become so afraid of their pain that they don't leave bed, and then they lose muscle strength and endurance, become isolated and depressed. Some of the strategies really quickly that you can use from a behavioral standpoint are pacing. Very simply, this just means learning your limits, trying to figure out how you can alternate sitting and standing activities to get more accomplished. It's really about working smarter instead of harder, basically. Adaptation means finding new and less painful ways to accomplish old things. That may mean, you know, sitting down to do your dishes, or wearing slip-on or Velcro shoes instead of tied shoes because it's too painful to put them on. It's frustrating. You don't want to have to do things that way, but you're still getting things done, and you're going to feel better for it and more empowered. And again, that's usually key to avoiding depression or those things that can worsen your pain. And finally, you can't be afraid to delegate and elicit support. I meet with a lot of people that feel like they're a burden, or that, that it's just people are tired of hearing about it, so they don't talk about it anymore. And when we don't talk about our pain or our experience, it'll find its way out in one way or another, either through more pain or anxiety or tearfulness or what have you. So, you still, chances are, have a lot to offer. You can delegate, you can work with your support person, you can tell your husband or wife, you bring the laundry basket into the living room and I'll fold the clothes, or find those things that you can still do. Don't try to do it all, but try to do what you can. And again, elicit that support. Don't be afraid to utilize that support. Chances are you can still return the support to others, at least on an emotional level, if not physically as much as you used to. So I think that's pretty much what I wanted to cover today. The last page here is just some references and recommended reading, all of which I used to make up this presentation, and then recommend you looking at some of those, especially the Managing Pain Before It Manages You.
Okay, well, thank you, Dr. Hansen. You really shared a lot of information, wonderful information, certainly understanding of problems people who are coping with pain are experiencing. Just to remind our listeners that questions can be submitted from the box in the upper right-hand corner of your screen. So we will begin with the first question. Let's see, the first question we have, what can I do when pain interferes with my sleep?
Well, that's a good question, and one that really comes up a lot, because people just can't get comfortable at night when they sleep, and then are up and down throughout the night, or very restless throughout the night as they sleep. And then it makes it harder for them to deal with the pain the next day because they're fatigued and cranky and all of those things. So, really a lot of the relaxation strategies that we talked about today can be used around bedtime, whether it's the breathing or the meditation, those types of things. Avoid a lot of physical activity before bed that can actually kind of rouse us up and make it harder to sleep. And then I would say, as frustrating as it is, don't be afraid to get up. If you're laying there for 20, 25 minutes and you can't sleep, get up for 5-10 minutes and do something light. Keep the lights dim. Don't rouse yourself too much, but take away some of that frustration. Maybe fold some laundry, or read a magazine article for a few minutes, and then try laying back down, so that at least you're not staying there and having the frustration mount and make it harder and harder to sleep.
A question that I can answer here, let's see, we need to slide back up to the top, was will we be able to see the slides? And yes, I wanted to point that out, especially the slide with the link. That give us a day or so, and at this same website, Mercy's website, /live, and you'll be able to review, listen to Dr. Hansen's full presentation, as well as pause it and get to the links. Okay. Question came in. How do you address how do you address a medical professional who thinks you are just depressed or crazy because of your pain?
That's an excellent question, and one that I hear a lot from people. A lot of people sometimes come to me assuming they've been referred to me because their medical professional thinks that they're just depressed or crazy. And so I try to assure them early on that that's not at all what the case is. When you're dealing with pain, you're usually more abnormal if you're not a little bit depressed when you're dealing with that amount of pain. I think you just have to try to find a medical professional that's willing to work with you in a collaborative manner. I mean, you certainly have to respect their expertise on things, but really you're the best expert on yourself. You know how you're feeling and how you're not feeling, and hopefully your doctor can communicate options and give you an idea of what the course of action is going to be. Assure them that you are aware of any depression that you might have, or that you're open to addressing that, but that while you're doing that, you still feel that you're just not right, and there are other things that need to be addressed. And I don't encourage doctor shopping, but at the same time, if you're not comfortable, you don't feel that your professional's listening to you, don't hesitate to perhaps seek another opinion. I met with one patient who said, when you go shop for shoes, if you try on the first pair and it doesn't fit, you don't just take them anyway. And so that's how she approaches working with doctors. If it's not a good fit, she's going to look elsewhere if she needs to.
Good advice. Medications were not mentioned in this presentation. Could you elaborate on the role of pain medications?
Yeah, please. Yeah, I'm glad that question was asked, because I don't want anyone to think necessarily that I'm discouraging people from using medications or from seeking medical intervention or just focusing on the psychological. Like I said, it has to be an approach that addresses all of those things. That really, I'm a psychologist, not an MD, so I will talk the best I can about some of these medications, but this wouldn't necessarily be my area of expertise. But there are medications that help to manage the pain in different ways. Some are narcotic medications, which help to basically kill the pain in a sense, or interrupt the transmission of pain signals. There are other medications like Sabella, Cymbalta, amitriptyline that seem to help with neuropathic pain as well. That they are actually, some of them are classified as antidepressants, but really are given primarily to try to help with that pain. So yes, if they're used responsibly while approaching other aspects of your pain, pain medication can be very useful.
This is rather specific. I don't know if you can just give a short answer to this. How to cope with spinal stenosis?
Well, I don't. I guess that's something that I may have to do more research on. And as far as, are there specific approaches for spinal stenosis that would not apply to other types of pain? I mean, I think most of the different strategies that I discussed earlier in this presentation would apply for someone dealing with spinal stenosis. But I would be more than happy to take your name or information and give you a call, and we could talk more about that.
Okay, very good. My husband suffers from chronic back pain. As a caregiver, what should I do or what can I do to help?
Well, I think that, as I mentioned earlier, the support and eliciting support and using support is so important. We all need support, whether we're healthy or unhealthy, but it's even more the case when we're dealing with chronic pain. I think there are a few things that you can do. One, just serve as a distraction. Read to your partner, invite them to play a board game or do something to take their mind off of things. Allow for them to express some of their frustration with how they're feeling. Yes, there's a difference between expressing it and venting versus wallowing and dwelling on it. Try to help them maintain that balance, but recognize that it is important for them to vent about things. And if it is becoming too much, encourage them to to get help, to recognize that in addition to taking their medication or seeing their doctor, that it might help to talk to someone about the stress of coping with chronic pain.
Another question, how does a person know what relaxation strategies might be best for them?
Well, I think that really there isn't a perfect formula to figure out what works best for you. I think you have to play around with the different techniques we talked about today, and see what fits best for you. See maybe as you try them which techniques you were able to get through without as much of that mind chatter that we talked about, and see which ones really stuck or clicked for you. Some it may be visualization, some it may be the meditation, some it may be just those mini relaxation techniques. But the other thing I guess I would say is for some, they just find it very difficult to sit still because of their pain or whatever else, and that may mean that you really want to try one of those repetitive motion relaxation strategies that get you moving a little bit in addition to practicing the meditation or breathing along with it.
Earlier you mentioned something about a support group. Are there support groups for people dealing with chronic pain?
Well, there may be more than I'm aware of, but right now there is a group that I facilitate at Mercy. It's on the first and third Tuesday of every month at 11 a.m. It's on the 4th floor near physical therapy, and we meet for an hour and have a good core group. And it's kind of an educational group as well as a support group or therapy group. We usually have a topic to discuss each day or each visit, and then it kind of goes from there with people sharing how they're doing, and again, talking about that experience of pain that many with chronic pain feel that others don't understand. And it's been really a neat experience to see people feel understood and share some of these experiences. So if anybody's interested in that, they could call at the 369-4777 number, and I like to schedule a brief individual visit before a person joins the group just to kind of go over the ground rules and discuss their interests and that type of thing. But would love to have people contact me about that if interested.
That's a great opportunity. Is there a difference between how men and women experience pain? I've noticed some differences. I just had another client. It was actually the same one that gave me the shoe example, but she brought an interesting article into me about men and women and how they experience pain differently, but also how they're treated differently by healthcare professionals. For whatever reason, the research suggests that women are often assumed by health professionals, especially male professionals, to have greater pain tolerance than men. And there's different hypotheses about that, maybe because of childbirth for women or whatever else, but that seems to be the expectation, when in reality studies have shown that on average, I don't want to offend anybody here, women actually have a lower pain tolerance. They've done studies that show where they had men and women submerge their arms into buckets of ice, and men on average were much more able to keep their arms submerged for longer periods of time. So it's unfortunate that that's the perception that women can tolerate it better. In the same article, there was a study that they had done where they had different male and female patients go to the same doctors with very similar scripts describing knee pain, describing what it was like and how it was affecting them. And at the end of their visit, they asked each doctor, should I have my knee replaced? And many, many more men were recommended to have their knee replaced than the women,
were recommended to have their knee replaced. So more aggressive treatments are often offered to men than women, and same with medications. There sometimes seems to be more of a hesitancy to apparently prescribe medications to women. I think another factor may be that women may be more prone to be emotional when they present their pain to doctors, and then as that viewer mentioned earlier, what do you do when a healthcare provider just thinks you're depressed or crazy? That may happen more often to women if they're emotional. Well, that the doctor may be more prone to chalk up a lot of it to the stress or psychological factors. So bottom line for women, advocate for yourselves, and the other interesting thing in this article was that female doctors seem to be better at treating male and female pain more equally.
Interesting differences, and hopefully you didn't stir up any extra discussion along the way. Another question here: how do you know if pain is more due to a physical problem or due to stress?
That's a question I get a lot as well, and again, there really is no easy way to answer that. I think it's best if you just assume that the answer is yes, that the answer is both, that it's just hard for, as I said earlier, the mind and body to be on separate pages, so that when we're under stress, we often feel it physically, and when we're physically hurting, we feel it mentally and emotionally. So we have to manage the stress and the psychological and cognitive aspect of it while still looking for that physical relief and following through with our doctors and taking our medication as prescribed.
Another question: do I need a physician referral to schedule an appointment with you?
You do not. Most people do end up being referred by their family doctors, but it is just fine to call the number that was listed earlier. That will be on the slides, and make an appointment.
Okay. I believe we have covered all the questions that were submitted to us, but if you have questions or are interested in scheduling an appointment with Dr. Hansen, you can call the number that was on the screen. It's the Mercy Outpatient Psychiatry at 369-477. A tape of this program will be available at www.mercycare.org/live, and as well as we, the question came in earlier, if you didn't catch some of the links or would like to, take another look at the outline. You'll also be able to check this website for information about future webinars. In fact, our next webinar is Parenting 101 with Deanna Glass. She's a social worker at Mercy's Birthplace and Pediatrics, and this will be held Tuesday, November 9th at noon. August 9th. When did I say there? At noon, and again at this same site. Okay, if there are not any additional questions, thank you very much. Great information, and thank you.